Hi.
Hello, welcome to Knock Knock Hi with the Glaucomfleckens. I am sitting here with...
Lady Glaucomflecken, also known as Kristen Flannery.
And I am Dr. Glaucomflecken, also known as Will Flannery. We're so happy to have you. It's a great day. We're talking about lots of things, as we usually do. But in particular, we're talking about pharmacies.
Yes.
Yep, today.
And we're talking about Amazon.
Amazon and the two of them together, Amazon pharmacies.
That's right.
Dr. Vin Gupta. Now, we'll get to our guest here in a second. But first, we have a new recording space.
Yes. If you're watching, this is the elephant in the room.
If you're watching, which we could probably fit an elephant in here.
We might be able to. It's a bigger room.
It's a bigger room. We finally did it. It's the same house. Like, we're in the same place. We repurposed our kids' old playroom.
Oh, it was a whole thing. We had to like rearrange half the rooms in our house because we have a daughter who's now in middle school, which for her and many children means she would like her own room. Exactly. So we had to do a lot of switching around of things. So
and if you are watching on YouTube and you notice that the books in the back are color coded, you can thank me for that.
You know, typical white man trying to take credit for the work of the woman.
No, Kristen did an unbelievable job with our decorations back there. So
thank you. It's still a work in progress, so you may notice some things changing over the next few weeks.
You know, people notice the color coding.
Do they?
The having all the red books and all the black books and all the white books. Like, people notice that.
Yeah.
It's very soothing, I think, to people.
For some people, it's polarizing because you either love it or you're like, that is the stupidest way to arrange a book. Usually those are your bibliophiles, you know, that's like how you have to separate a series if each book in the series is a different color. And how do you know? Okay. So I get both sides because I am also a bibliophile, but I am also what's a designophile? I don't know. I have a color obsession in particular.
Word for that?
I don't know. Probably.
I don't know.
Somebody could tell us in the comments.
But I have one more thing I want to talk about.
What?
I'm a very proud dad right now.
Oh, why is that?
Very proud dad. Because last night.
Oh, yes. I know what you're going to say.
Our 8-year-old delivered an invitation to me.
Yes.
I'm going to read the invitation.
Well, not to you, to everyone in our family.
To everyone in the family.
We all got one.
We all got an invitation. It says, to Daddy. Comedy Joke Club. Come join the Comedy Joke Club, which she abbreviated CJC.
Yeah. Learn
how to make funny riddles and jokes. 6 p.m. on Sunday, Tuesdays, and Thursdays.
It's ambitious.
Three night per week Comedy Joke Club. Where, you ask, is this going to be happening? The living room on the couch.
Yep.
All right. I am so happy. A joke club.
A comedy joke club, not any kind of joke club.
I've already got plans. Like, we're gonna find a topic. I'm gonna have the kids choose a topic, and we're gonna create jokes around that topic.
What kinds of jokes?
I don't know.
You'll have to put in some restrictions so that it's
No. There's no restrictions on comedy.
Restrictions enhance creativity.
I will see what they come up with, and I will help them formulate a punchline, setup, all the things.
No, I think it'd be good. I mean, we'll see how long this lasts. Kids' attention span is like 4 seconds, but
hey, 5 minutes, 3 times a week. I mean, we could do like 5-minute increments. That's fine.
That's true. That is true. But I do think, in all seriousness, I do think it is a fun idea to think of you teaching comedy to our children.
Yeah.
Right? Like, not just, I'm sure
excited.
they're like picking things up by osmosis, you know, but to have you like sit down and explain to them the mechanics of a joke or what makes something funny. Like, I think that's pretty fun.
I can't wait. I'm excited. All right. So let's talk about our guest. Dr. Vin Gupta is a practicing pulmonologist who serves as chief medical officer of Amazon Pharmacy. Many people are probably like, I had no idea Amazon had a pharmacy. Well, you're going to hear all about it today. He is also affiliate faculty at the University of Washington's Institute for Health Metrics and Evaluation and Evans School, and a major in the U.S. Air Force Medical Reserve Corps. Very accomplished individual.
Doesn't he do?
He also serves as a medical analyst for NBC News. So he's done a lot of things, a lot of fascinating things. He draws on his expertise and now as his role of chief medical officer of Amazon Pharmacy. So fascinating discussion. Should we get into it?
Yes.
What do you think?
Let's go.
You ready?
Ready.
All right. Here's Dr. Vin Gupta. Today's episode is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. To learn more about how Dax Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover Dax. That's nuance.com/discover DAX. All right, we are here with Dr. Vin Gupta. Thank you so much for joining us. It's a pleasure to have you on.
It's a huge honor to be here with you guys. Thank you. Happy New Year.
So I've just, I've been looking through kind of what you've done in your career so far, and like critical care air transport physician, U.S. Air Force Reserve, critical care pulmonologist, chief medical officer, Amazon pharmacy. Like if I saw this stuff, I would think you were like 60 years old.
Mhm.
But now that I see you, you're clearly only like maybe
You're like our age.
you're like our age.
Yeah.
And it's like, what am I doing with
Yeah.
my life? My goodness. Just congratulations on everything. It's really impressive what you've where you're at in life right now.
Well, coming from the two of you, that means a lot. But just like the two of you, honestly, I feel like there's different ways to have impact, and
Yeah.
and I think that's just what's driven me.
Well, I want to start. Well, first of all, before we started recording, you have this very interesting thing in your background behind you, and you were telling us it's a Hindu deity. It's got a nice frame around it, and then it was about to lead to a story of how you met your wife, and we wanted to do it on air, so because I'd love to hear it.
Yeah, sure. So we. Long story short was I used to ride the school bus with my wife back in a small town, Sylvania, Ohio, not far from the border with Michigan. And so we, many years, 5 minutes apart in the same neighborhood. And she used to go to Catholic school. I remember this really pretty girl coming on, back when I was wearing these massive glasses. She wanted nothing to do with me. And there was just, I could never get sort of the time of day. I remember we're both Hindu, and I would go to our local temple, and we'd have these massive events for Diwali. And I'd walk in, and I'd see her with her friends, sort of point and stare, and I was the guy on the school bus, and
Mhm.
and that was 25 years of that, and we never actually communicated. But then towards the end of medical school, I was in China. I lived there for a few years and was just on this research fellowship. And she was coming out for a traditional Chinese medicine sort of 2-month rotation towards the end of fourth year. And we had a mutual friend who knew me way back in the school bus days, and who is now her classmate at Ohio State Medical School. They're like, you should reconnect with Vin, and just look him up while you're there. And so, but I came back right before, and I had convinced her that, hey, let's go on a few dates here back in Ohio. And if you don't totally hate me, why don't you travel with me in Chinese New Year to Indonesia and to Thailand? So we actually started getting, we dated in the best possible place to give me the best possible leg up, which is Southeast Asia. And so this is from that trip in Bali.
Great.
Yeah. So I was
Kind of like The Bachelor, right? Like
Oh, man.
you're trying to convince these people to fall in love, and so you go to these romantic places and do incredible things.
But you guys didn't go to med school together?
No, so I was at Columbia, and she was at Ohio State, and so we had a mutual friend that made that connection.
And then you ended up in critical care, and I understand you do still practice medicine. I think nights, right? Is that what you primarily whenever you do have shifts?
Yeah, so about 30% of my time I'm a civilian pulmonologist in hospitals here in Seattle, and then really important to me to be at the bedside, and then still have that reservist component where I still practice whenever deployed.
Nighttime in the ICU. That sounds like it easily top 5 most scariest places in the hospital. Like
Oh, man.
I don't.
Oh my God, it's just whether it's a unexpected code, or I get to work with residents who they're experiencing it for the first time, or some bloody dialysis line that you have to do at 3 a.m. I mean, it is. I will say, in this world where there's different ways we were talking about this earlier, have impact, to still be at the bedside and to still have to, practice the same medicine I practiced 15 years ago when I was my first time in the ICU. It's humbling, and I think it's really important.
And now you said you still, so you're in civilian medicine, but you also still have this military kind of reserve career. So what's the
Yeah.
balance? Tell me about that a little bit.
Well, I'm going to say, since you obviously have such reach, and we all love the two of you in medicine, I will plug that I got my start in military medicine way back in medical school. The recruiters, when I was
Uh-huh.
out in New York, know where to position themselves at 2 a.m. in the morning on a Friday night, and so there are these like military medical recruiters
I
right
remember those
outside the.
recruiters. I remember
Yeah.
those. Yeah. Yeah.
They
They
took
come.
one look at you and were like, no.
No, I remember they would come and, when you first during orientation, at least that's when I remember them. They'd set up their booth and, very
Yeah.
nice, military officers with full, uniforms and everything.
Yeah, exactly. And so, they wrote me in, but it ended up being a pretty. I mean, I've done this for about a decade, and coming up towards the end of my payback, and it's been an incredible experience. And I think there's a huge gap between how a lot of us conceive of it, how recruiters talk about it, and what the experience is actually like. So I do
Mm.
in the military exactly what I do in a civilian hospital. I'm an ICU doc, and that's rare. Rare. Often, you can be an ophthalmologist on the outside, but on the inside, you're doing just flight physicals, or you're checking blood
Oh,
pressures
really?
or checking labs. And so
Oh, okay.
rarely is there that sort of matching of skill set, civilian to military. But I lucky sort of specialty where they need ICU docs, and so I
Okay.
practice 30,000 feet ICU medicine. I've deployed a few times for short-term stints, and really it's just providing ICU level care at 30,000 feet, moving a soldier or a contractor from, say, the Middle East back to Walter Reed, but those that have critical care needs. So it's actually a fascinating example of our reach in the U.S. military, and I think a capability to see more and more as we have less operating bases overseas, like a
Sure.
big base in Afghanistan, more sort of mobility focus.
Cr- Critical care medicine is like hard enough, and then you're like, hey, I'm gonna
Yeah.
go
On
do
an
that
airplane.
thing 30,000 feet in the air.
Most airplanes don't even have EpiPens on them. So,
Yeah,
what does
exactly.
your airplane look like?
Well, I mean, I
Yeah.
guess, it makes sense that you need to do that, but I mean, what size plane are we talking about? Like
Yes.
what's your
I mean,
setup there?
it's a C-17, and there's no seats, and so it's literally for aeromedical evacuation. So there will be non-critical patients that will be towards the front of the plane, and then imagine just an open bay. We have what are called stanchions that you can put litters on, and those litters, on top of the litter, there's the patient. On top of the patient, there's something called a SMED, but it's basically this little platform that you can attach a mobile vent to, suction, a monitor. You literally have a mobile ICU on this platform positioned right on top of the patient, on this sort of frame that attaches right to the floor of the plane, and it's a mobile ICU. It's pretty incredible. But we have epinephrine uh, drips, so we've advanced well past pens, and
Yeah.
it's pretty incredible. It's pretty incredible.
Wow. So how much of your time are you still doing that?
Yeah, and this is the thing about, I'm one of the biggest. I'll answer your question
Sure.
like in a circle here, but
Take your time. Take your time.
one of the, like I keep getting reminded because I'm at 10 years. I'm about to step out at least for a little bit. It's hard to square, but it's a weekend a month, 2 weeks a year. On top of that, if you get deployed for 4 to 6 weeks, what have you, so it can add up to about 50 days a year on top of
Mhm.
everything else. And you're doing this on what would otherwise be free time. So I guess it just depends on what the rest of your makeup of your life looks like. But if you have a busy professional life on top of it, it's hard to square. Um, what's interesting though is that the military medical corps across the Marines, Air Force, uh, Navy has about 60% of the docs that they need coming into the pipeline to replace those leaving, because nobody wants to do it,
Oh,
and it's an interesting, I think, less talked about national security risk that we just don't have enough medical capability to care for those that are going to need to, go out to the Western Pacific, maybe, or just
yeah.
given the world that we live in. So it doesn't get talked enough about, in my opinion. So thank you for highlighting it.
Well, let's talk some more about, because I'm interested in this, and what are the barriers? What is it that those med students who come in, who maybe like, I had no idea anything about military medicine, and what is it that's keeping people away from that? What are the fears that maybe are unfounded, or that are maybe too the things, that rumors that go around about military medicine that maybe are not so true, and so just help us understand what's keeping.
Does military medicine have a PR problem?
Yeah,
Yeah.
what is it exactly?
I think it's a huge PR problem. And there's a lot of misunderstanding because the recruiter, and I'm not trying to throw recruiters on the bus, but the recruiters for docs, let's just take that, are often coming from a totally different part of the military, and they can no longer do that job. Like, there many were former mechanics that can't do the job of being a mechanic anymore. So then they slot into being a recruiter and randomly become a health professions recruiter and don't have any content expertise. And so we're telling these people to do a job and answer questions to folks like us that are, pretty high maintenance. If you think about it, we have a lot of
Right.
Oh,
needs
You're
that
gonna
yeah.
we
have a
wanted
lot of
to.
questions.
We have a
Yeah.
lot of questions, and
A lot of
we have
type A personalities.
a lot of type A personalities, and they want details, and they need to know everything and how it's going to work out. And often they get told a story that's not accurate, and
Mm.
not because anybody's mal has bad intentions, but because they aren't the right recruiters for the job. And so often what gets said is, well, you're going to get X amount of money over X amount of time, and that's wrong. And so there's over promising of financial support, which is bad because many people. I did this for, frankly, for financial support during training.
Mhm.
A lot of people do that, and if the money doesn't square, the support doesn't square with your expectations, and you feel like, why am I doing this? Um, Often there's this fear. The second fear is, am I going to get sent to war and die? And the reality is, as a doc, and most, I'm on the runway in Bagram Air Force Base picking up a patient, but rarely is there an exposure to battlefield medicine. So you are a little removed from direct threat, even though you're still in the theater of war. So there is, I think, a misperception of threat. There's some threat, and there's some risk, but it's pretty managed and mitigated because
Sure.
they need you. I think the third is, and this is what I've seen evolve over the 15 years. There felt like there was patriotism and a call to duty that existed in the mid 2000s that I can't tell you how many people now, whisper like, why am I doing this? I don't understand. I don't believe what we're fighting for. I don't believe in this potential war with China and the Western Pacific. I want to get out as soon as possible because there's that lack of clarity as to the purpose of the U.S. military in this world, frankly, and what we're fighting for. And so I think that third piece actually might be the number one driver of low recruitment. People just don't feel that sense of connection and that sense of wanting to serve in the first place because of everything that we see go around in our
Right.
politics and what have you. So that's what that worries me.
And that third thing seems like the most difficult one to change the perception on, right? I mean, it's because that we're talking about kind of population as a whole, and how people are feeling, and the impact that also that social media has on all this stuff as well. So it's interesting.
Yeah.
Yeah.
I certainly would have been. I, I would say I thought about it. I mean, I definitely, it was like, I was like, oh man, not having to pay back any student loans,
Yeah.
like that was, that's a huge. I mean, think about the cost of medical education now, and
Yeah.
like, we're still paying back our student loans. So
Yeah. The only thing I remember you thinking about was being an astronaut doctor. So I don't know about
well,
this
that's a lot of them. That's military,
That's
Well, I'll tell
now,
you.
I
So,
guess. Yeah.
so my dad worked in aerospace, and he's retired now, but
Huh.
he's working with NASA and all these people, and so like, she would never have let me be an astronaut, but I don't know.
And look, I was right.
I think that's a path you can go down from
Mhm.
the military side of things, right?
Yeah. Yeah.
Did you ever think of being an astronaut?
Yeah. Gosh. Yeah. It's not my cup of tea, but I do know a few docs who've gone Marine to the astronaut
Oh
sort
yeah,
of
yeah,
path. So yeah, 100%. That's wow. So astronaut. That's I
yeah.
Yeah, I just this
There's no way
misunderstanding.
No, that was an immediate veto. I'm not going to be married to someone who's not on this planet. That's just not in my card.
But it is surprising to me actually to hear you say that what you want to do, say in like civilian medicine, you're practicing as a pulmonologist, is not necessarily what you're going to end up doing in the military. Like that is surprising to me.
It's a big
I
problem.
guess.
Yeah, I mean,
Yeah.
I can't, I mean that's the other piece too. There's a lot of surgeons I know. I know a few neurosurgeons who are just checking boxes as primary care docs, and there's nothing against
Wow.
primary care docs, of
Well, it's just not what they want to do with their career, right?
It's not exactly.
Yeah.
It's like how
Interesting.
you're telling me there's not a better way to leverage the skills of a neurosurgeon,
Right.
and try to have them practice to the top of their training. But so there's a lot of inefficiency, misuse, miscommunication. Unfortunately, it impacts recruitment in a really significant way.
Yeah. Well, you made a big, it seems to me, a large change in your career.
Yes.
Going from all of this critical care medicine, and then I see that you're the chief medical officer of Amazon Pharmacy. So help
Yeah.
us connect the dots here, because that's a big change.
Yeah, I was full time back in 5 years ago. Sort of full time physician scientist, just coming out of fellowship. Really liked it, and at the time had this opportunity. I was finishing up at the Brigham, and my mentor at the time was leading part of the Apple Watch's study on the sensitivity of its various health features to, say, detect a fib. In this case, it was the oxygen functionality. So I got connected to the Apple team as a fellow, and they were working on, well, how, can we use this for patients with COPD or emphysema or what have you? And meanwhile, I'm in, my fellow primary care docs and pulmonologists will know this well, where you're in this 15-minute visit with somebody with COPD, and you're trying to look at their Mead notebook and see what are they sat like 10 days ago, and how their oxygen saturation curve is changing over time, and what about their 5-minute walk. And here is this new innovation that people want on their wrist, whether it's this or Fitbit, and it's automating that whole process, and we can just get a dashboard view on it. And so I got connected to digital health while I was full-time clinical, and just ran with it. So I was with Apple for a year, and then just being in that ecosystem. Amazon was hiring at the time in 2020. I was back in Seattle, and it just felt like this brave new world of streamlining evidence-based, high-quality medicine with the best of tech, especially consumer tech companies that knew how to really unlock a great experience. So I took this opportunity. Amazon said, "Hey, we'll still let you be clinical part-time. We'll still let you do all the things you want to do on the outside, but come join us and help us build a better way to provide care for patients." And this was right before the pandemic. This is January 2020 that I joined. Pandemic hit. Things changed for me in my external roles, obviously clinically, but then it sort of put on an accelerated path what Amazon was doing in at-home healthcare. Experienced the company over the last 3 years, got to know different parts of it. My core was what I experienced, what I learned at Apple in consumer wearables, and ultimately landed on the Amazon Pharmacy team in early 2023, building what I just think. I mean, I'll say to the two of you, not to put words in your mouth, but I was really motivated to join the team because as a clinician, I absolutely hate the retail pharmacy experience as it is today for my patients. It is a frustrating experience.
Yeah.
I can't tell you how many times it has led to non-adherence on inhalers or what have you. And here is a company that I think knows how to unlock great experiences. And I thought that, to me, it felt like an interesting just opportunity to learn from incredible talent. So that's why I'm here.
Yeah, and I want to really dive into this idea of Amazon Pharmacy. Let's take a quick break, and then we'll come right back. Hey, Kristen, doesn't it seem like AI can do anything?
It seems that way. It's
Right?
everywhere.
It is, but have you heard of Precision?
No, tell me.
This is the first ever electronic health record integrated infectious disease AI platform.
That sounds fancy,
Yeah,
but
it's
what does it
really
mean?
exciting. So for any specific patient, It takes all the patient's clinical data and automatically highlights better antibiotic coverage in real time.
Oh, nice.
Yeah, it empowers clinicians to save more lives while also working more efficiently and
Mm.
quickly. To see a demo, go to precision.com/KKH. That's precision spelled with an X instead of an E. So PRXCISION.com/KKH. All right, we are back with Dr. Vin Gupta. So Vin, I know from my personal experience, like going through medical education, medical training, get very limited information, knowledge about how pharmacies work, about the pharmaceutical industry, regulations around pharmacy. So what kind of, I imagine you faced a pretty large learning curve and trying to just understand the landscape of the world of pharmacy whenever you were kind of thrown into this CMO role.
Oh my gosh, yeah, I wouldn't even say that's an understatement. I mean, there's so much. This is such a complicated, highly regulated space, as you just said, and so I'm constantly learning. One of the reasons
Yeah.
I took the role was just to learn. Uh, it's amazing too because one thing I've noticed when I'm an inpatient ICU doc, I have an inpatient pharmacist right at my side,
Right.
correcting orders. No, Vin, don't do that. No, Vin, do this. On the outpatient side, we
No,
don't
Vin,
have
don't kill
that.
the patient with that
Yeah.
drug interaction. Yeah, exactly. I
Exactly.
remember those days for sure.
And it's you love it. I mean, you come to rely on it and
Yeah.
in a really serious way. And you don't have that, to state the obvious, outpatient providers don't have that at their
Right.
fingertips. And really, truly, I oversee a team of clinical pharmacists that are in part trying to build that experience for outpatient providers, One Medical to begin with, and then maybe as we're growing, more and more providers. But really, to say, hey, let's give a provider who's caring for a patient with multiple chronic diseases in and out of the hospital. Let's let them call a consult and let's review medication lists together, figure out what we can do to maybe deprecate medications, optimize therapy. And and in this world where retail pharmacy windows are closing and narrowing their hours, to me, that's where there feels like there's one value add to Amazon Pharmacy among many. But that's definitely one. But yeah, to your point, it is an incredibly complicated space. But as we are decomplexifying it, we're realizing that there's a lot of inefficiencies. You mentioned PBMs and how we procure drugs, and the
Yeah.
price increases that are baked in at every journey of at the journey of the medication being procured from the manufacturer ultimately to the patient. There's price hikes at every step of that journey. And as we're
What is
talking
that?
about,
Just for people who don't know, aren't familiar with that.
With pharmacy benefit
Yeah,
managers.
can you guys speak? Because I'm not in medicine, so I learn a lot
Yeah.
of this just through him and his silly videos. But
Yeah, because
how
so
does that work?
as you know, like I've been very critical of pharmacy benefit managers like Optum and uh, CVS Caremark and all these basically these are they've started out as like insurance. I mean, they're still insurance companies, but they have the separate arm that are what are called pharmacy benefit managers that initially when they started they were designed to try to quote unquote rein in the pharmaceutical companies and keep medications affordable for patients as kind of a go between between the pharmacists and the pharmaceutical companies. But I mean, if you ask of PBM, they're going to say they do that. But I think
Right.
the reality is there's it just adds this kind of middleman type of scenario where you have this PBM arm of these companies that are kind of extracting wealth from the healthcare system and generating a lot of money for themselves with questionable impact
How do they do that? Where
on
does
the
that wealth
consumer
come from?
side. How does what?
How do they extract the wealth? Where does that come from?
Well, Ben, do you want to kind
well,
of talk about this a little bit?
yeah. So really, I mean, exactly what ends up happening, and as was just mentioned, is yeah, drugs are procured through these entities, these pharmaceutical benefit managers, in many cases, directly from an Eli Lilly or any pharmaceutical company at a certain price, and then they're sold to distributors, pharmacies at a different price, and usually that there's a markup there. And so that markup of what they acquire the drugs at versus what they then sell the drugs at to pharmacies across the country, there will be a margin there that is
Right.
introduced because they're sort of that interlocutor between.
Versus just the pharmacy buying directly from the
Right.
manufacturer.
That's
Okay.
And the
exactly
idea
right.
is that that those savings, they should be passed down to patients,
Mhm.
right? On
Right.
the consumer end, but is that happening? And so
Right.
that's where a lot of the controversy comes into play.
Is there regulation around that to make that happen
Well,
or no?
that's a good
It,
question.
this I think
Am I
this is
stepping in something?
I mean,
no,
yeah, it's a
and a
huge,
good thing. No, I mean this is changing literally in real time. We're seeing this with the weight loss drugs and what Lilly
Mm,
announced last week, which was this direct effort that they're setting up, Lilly Direct, uh, at trying to meet this moment of incredible demand for these GLP medications, these weight loss medications.
like Ozempic,
mhm.
right? Yeah.
Exactly. But now they're saying, hey, we will help facilitate and directly distribute through third party telehealth providers and distributors. We will start to be more directly involved in distribution. And as a result, you're actually seeing the price of the medication because they're more directly being involved in direct patient care, again, through partners. The price of the medication is lower. And what's being billed to insurance, what the ultimate copay will be. Cost plus drugs are, as a
Yeah.
stakeholder in the space, doing something in generic and in some cases branded medications, direct wholesaling or wholesale procurement of medications from manufacturers. There's a reason their prices are very low. We're working with them in some interesting pilots in California in particular, because we think that we can add incremental value. But this is changing in real time. So everything that you've been talking about is having impact because this is such in the complexity of the space. I think this reality has been allowed to go on for decades, and now finally people are pushing us to like, why is this actually happening? And they're
Yeah.
decomplexifying it.
Mm.
I think you're going to have a lot of people who are skeptical about this behemoth of Amazon and, um, the at times, less than favorable PR that comes from, Amazon and how they treat their workers and all these things. And so you're going to have a lot of people that think, oh, Amazon's going to be in charge of my medications. And so and people have problems. I think people are going to compare this to the current uh, um, uh, uh, mail order pharmacy delivery systems out there, which is primarily run by United Healthcare, like OptumRx and Express Scripts, to name a couple of them. And so, what would you say to those people who are maybe skeptical that this is going to be a better service for them than what's already out there?
I'm glad you're asking that because we are constantly learning. I one of the reasons I stay very close to the bedside is because I don't want to lose sight of the problems that exist today. And and so having a foot in both worlds to me helps at least keep me honest as in serving this role for Amazon Pharmacy. I would say that at a high level, there is so much opportunity for improvement, and and the existing incumbents, like you've said, ESI, mail order delivery more broadly, that still only represents 10% of all prescription fulfillment across the country. 90% is still, let's pick it up at that retail counter. And we know what that experience is now continuing to become. It's just not meeting patient needs. What worries me is that things that are not sexy problems to talk about because the solutions are really complicated. So often we don't know the solutions. Medication non-adherence, $500 billion problem just in terms of dollars, but we know what that means for readmission. We know 30% of people don't pick up the refills just because it's
Mm.
too difficult. A, a stat that astonished me, and I operate in the space all the time as a pulmonologist. 85% of the time, there's a coupon for branded medication like an inhaler to lower the price to the patient. 85% of the time, it goes unapplied because people just don't know it exists. It's
Yeah,
just,
I've never heard of a coupon for my prescription. I mean, I don't
and
have an inhaler, so maybe it just doesn't apply to my prescriptions, but
well, no,
I
I'm
didn't
glad
know
you
that
brought
was even a thing.
exactly. More drug classes than just inhalers. So even the GLP, the weight loss drugs have coupons in some cases, other medications, EpiPens. But most people don't know these coupons exist if they're
Yeah.
prescribed a relevant medication because the pharmacist, they're reliant on the retail pharmacist who's overworked to educate them or their provider to say, hey, go to this website, download this set of forms, submit it. That's how you get the discount. It's a ludicrous process. And yet
Yeah.
that's the process that exists today. And so Amazon is automating that process for a group of branded medications. So if a coupon exists, it's going to be automated and it's a true e-commerce experience. You don't have to think about it. And that's solving an obvious problem. Direct to your doorstep delivery, I think that helps with that refill problem that we talked about. But then even price transparency, it's amazing to me that there was a study done by actually a group of pharmacists that was published in the Annals of Internal Medicine about 4 weeks ago. And it looked at the 20 most commonly prescribed generic medications across the country, lots of them cardiovascular. And it asked the question, does GoodRx or does our Prime Prescription Savings Program, does GoodRx versus copay, are any of those providing additional cost savings? So would it be better to not use your copay and use a discount program through GoodRx or through us? And it found that if people used us or GoodRx, they would save upwards of $970 million in aggregate on the 20 most commonly prescribed generic medications across the country, meaning insurance isn't often your best choice to purchase at least generic medications. I just think there's so much lack of information and awareness on how to build a better pharmacy, how to get a lower cost medication, that to your point, if there is a trust gap, I think once you start to
Yeah.
deliver on things like lower price, direct to doorstep delivery,
People see it. Yeah.
people see it.
Yeah.
It certainly sounds more convenient. I mean, I think no one can argue that about Amazon. And, cost savings and all of that sounds really good. But just as a consumer, when I think about Amazon delivering my medications, one of the things I worry about would be, and I don't know, maybe I am a little paranoid. I'm almost, I'm
Someone's gonna steal
like a
your.
very mild doomsday prepper kind of a person,
I am too.
Uh,
Yeah.
Good. Okay. So I think about, well, Amazon already knows all of my purchasing history. Do I really want
Sure.
them knowing my medical history as
Oh, yeah.
well with all of this? Do I want them knowing what things I'm getting prescriptions for and what they are and how that's going?
question.
And are there, there's like a big data problem with this too, I think, for consumers.
Well, I'm glad you brought that up because I'm sure that's not on the minds of many people that use Amazon for their retail purchases. I can share what I've seen directly get built, which is that your health data is your health data, and it's completely compartmentalized and completely blocked off and held sacred in a very similar way to what we do with patient data in the four walls of a health system, brick and mortar health system. So there's no crosstalk between health data and retail data because everything that Amazon Health does is completely guided by HIPAA. And so that data is very much compartmentalized. I agree with you that this is convincing people that that data is held sacred, that it's not going to be used in any way
Right.
to.
Because you mentioned trust. There's not a lot of public trust in how companies use data right now either after Cambridge Analytica and, the
Sure.
aftermath of all that.
Well, and we've seen other digital health providers. I should note that Amazon Clinic and a few of our other entities were recently scrutinized with a bunch of other telehealth companies and with regards to how we handle health data. And we were the only one, I think this is published in the Washington Post, that were found to actually adhere to the tenets of HIPAA and to treat health data the way it should be, which is not to crosstalk with any other sort of consumer-like behaviors. So I do believe as a clinician that the company completely is standing by its commitment. But because there's some high profile examples where other tech companies are not have failed or have misstepped in that space, I'm not surprised. And I think the onus is on us to make sure that we continue to say that your data is private, it's sacred, it is going to be held and treated in the same way that it is within the four walls of a hospital system. That burden of proof is still going to be on all of the new entrants in healthcare, including us, to actually to show that we mean what we say, and because I think there have been missteps elsewhere.
Right. Yeah. Because, you could envision a world where, I don't know, like if you have an anxiety medication through Amazon, then you start seeing ads for, weighted blankets or other things that might help you with your anxiety, right? Like that'd be a little bit
Oh, it would be
icky.
inappropriate. Yeah. No, and
Yeah.
so we don't do that, to be clear. But for the reasons that would infringe on patient protected health data and the ways in which it could be shared. But
How
there
does
have
that
been
get enforced? I mean, it's HIPAA protected. Is that
so we just have so we have a security system and a patient data team that just complete that ensures that uh, one person said we have a series of systems in place that by which I'm you know, very non-expert in from a
Yeah,
sort of
I'm
a
probably
technical
asking
standpoint.
questions about
Um,
like the weeds.
but no, it is to say that we have we have security experts and data experts that make sure that siloed data, especially health data, doesn't crosstalk. That there's constant monitoring for, say, yeah, any type of cyber invasion or intrusion or attack that would weaken our infrastructure. But the relevant experts there are constantly mining that to make sure that remains siloed and protected. It doesn't crosstalk.
So when you're building out our doomsday
Hmm.
shelter, like don't worry. Like there's we'll
Yeah.
we'll it'll
Will
be private.
subscribe and save be
Well,
available for my prescriptions?
exactly.
Exactly. Well, I will say that, I mean, truly, if I I mean, I cannot tell you how many patients come to me and say, that met. I drove in, it took me 2 hours to get my Advair, and it was way too expensive. Prescribe me something else. There's so many unforced errors in the pharmacy
Mhm.
space, and there's lots of opportunity to improve. I think Amazon Pharmacy will be part of the solution. Not one entity can't solve it all, but I do believe that if there's one thing that Amazon's going to do extremely well in,
Yeah.
I'm very bullish on our ability to be at the doorstep, provide price transparency, provide virtual access to pharmacists, and that to me is a helpful set of solves for what's ailing the pharmacy
How
ecosystem
long
today.
has how long has Amazon Pharmacy been up and running? Like how long has this been
It's
going on?
so since 2020, and so our
Okay.
origin was in PillPack, and the acquisition of PillPack. And then we built Amazon Pharmacy, which is a 50-state virtual pharmacy, direct to doorstep delivery, mail order of all your medications. We have 7 brick and mortar fulfillment centers across the country, and are trying to get faster so that if you, say, had an acute antibiotic in Manhattan, we can deliver that to you same day.
And then a whole fleet of drones, right? You got,
Well, like
you
specifically
got
for
the
College
drones
Station,
going?
we got some drones going in College Station, Texas, as at least a proof of concept that uh,
Why College
Yeah,
Station?
of
I'm
all
curious.
places.
I know. Well, we say that as we both went
We
to
went to
Texas
Texas Tech.
Tech, so we're Red Raiders and bitter rivals of everybody else in Texas, in
I
particular
think
the Aggies.
we actually searched to see where you guys went to school, and then we decided to
Yeah,
Yeah,
that's
support
why.
your
that
alma.
was the deciding
Um,
factor. Yep.
but I was going to say that so that's where Prime Air actually launched its initial set of
Oh, right.
services,
Yeah.
and so we built on top of that.
Oh, gotcha. Okay.
Who knew?
There you go.
Yeah.
You can get your insulin delivered via drone.
Yeah. Too windy in Lubbock, so we couldn't
It
have done
is.
it.
That's the
Yeah.
thing. Yeah, that must be why. They tried. I'm sure they tried to do it instead of College Station, tried to do it in Lubbock, Texas.
Yeah.
But it was like, oh no, it's way too windy. Let's we'll save it for maybe our more powerful drones.
There's like 4 people listening who understand this joke.
Lubbock is not exactly a destination for people, but
I think 2 of those people are your parents.
yes, exactly. So.
So you guys still
Is
go
that the
back
future
there?
though? Is that I mean, is it like how serious are you guys about this whole the drone delivery thing?
I think the future is certainly serious to learn, and
Sure.
one of the when Prime Air asked their customers in College Station what they were most excited about as an additional feature set, one of the most common replies was prescription medication delivery, which is why we decided to roll it out in partnership with them. I think the question, what we've noticed, and what I think is absolutely the future, is hyper fast delivery, and people come to expect that of Amazon. But it's not just an expectation of Amazon. It's a broader expectation in this world of test to treat and the pandemic. And the two of you know this as well as I, that and this is just not something health systems writ large are fantastic at, but if you can diagnose somebody earlier in the course of their illness, chronic or acute, in almost every single case, getting them something started as quickly as possible, a treatment, antibiotic or a chronic med, it's probably going to be helpful, especially the acute antibiotic or antiviral. And we just saw 3 years of that experience, that holistic journey be incredibly difficult to unlock for patients across the
Yeah.
board. Delays in testing, many days of delay in treatment. And I do think when we think about clinical impact and value at a low cost, Amazon doing hyperfast delivery and narrowing the gap between testing, triage, and treatment. That's what I'm excited about because we don't have enough providers to care for patients by the end of the decade. We're going to have to protect hospitals for the next and
Right.
ERs. So how do you actually do that? We talk so much about it, but how do you actually do it? And I think it's early intervention, early diagnosis paired with early treatment. And that's again where I think we can be part of the solution, where we can deliver hyper fast, keep people away from urgent care and the ER. The more we build awareness that we can do that.
So, am I hearing you say that Amazon, or maybe they already have, are moving into the telemedicine space?
Yeah, so very much, I would say since, gosh, uh, you know, certainly the beginning of this decade, 2020, I joined Amazon Care, which is now, we got a lot of great learnings from Amazon Care, but it's our telehealth platform
Mm.
with some in-person component that has now given way to a few different opportunities that we're really excited about. One is Amazon Clinic, which is a marketplace for external telehealth providers to provide their services and at a low cost, across a range of different conditions or needs. And so I think almost 40 different conditions are met through Amazon Clinic. You can go to virtualcare.amazon.com if anybody that's listening is interested in learning more. And we just recently acquired, and this closed about a year ago, One Medical, the acquisition of One Medical, which is in person and virtual care in about 30 markets across the country. There's that in person component coupled with 50 state access to virtual care. And obviously I'm biased because I see what gets made and I see the quality behind it. And of course, I'm affiliated with these efforts, but I've transitioned my entire primary care to One Medical. It is, it solves the issue of access and timely access. You don't have to call anybody. Same day you can get an appointment. Amazon Clinic, uh, the payment is often less than your copay for immediate access to triage services. And so you can really go from test to treat if you wake up feeling unwell using our services and get what you need within a half day at a very low cost. I think in a world where the Commonwealth Fund says 1 in 2 people don't have access to same day or next day care if they're acutely ill, this is right before the pandemic, they published that finding. That's where I do think what we're building, what some of our peers are building, is going to help be part of a broader solve.
Is this a pretty competitive space, or do you? Because I hear a lot of kind of collaborative efforts being done. You talk about cost plus drugs. What's the landscape right now of this space? And are there a lot of people doing this? Is there a lot of competition here?
I would say very collaborative on the pharmacy side in the sense that us plus and us are just worked just announced with Blue Shield of California an effort to source drugs differently. So Cost Plus is going to source medications directly from manufacturers across a range of different therapeutic categories for enrollees within the Blue Shield program in
That's
California,
interesting.
and then we'll
I,
distribute
I
them.
would kind of assume that you'd be at odds with the big insurers.
Well, there's there credit to Blue Shield. They're looking for value, and I think so many people. Yeah, how many times do we talk about value based care? It's just become it's almost become meaningless to some degree because we talk about value based care. It's still in a paradigm, at least in hospitals, that's very much fee for service
Right.
and quantity versus quality. So I tip my hat to Blue Shield, to Cost Plus for being willing to partner with us. I would say very collaborative in the sense that let's take everything that we see every day. There's a new headline, amazing therapeutic that does this for weight loss or heart disease. There's a new COVID flu over the counter test from Pfizer. And most people don't know about it because it's $40 a pop. And I always get during the October, sort of November season, I got a lot of people asking me about the RSV vaccine. And
Oh
at the
yeah.
time, insurance wasn't covering it. And now they've changed. But to me, if we're talking about value-based care, keeping people out of the hospital at the lowest cost possible, keeping them healthy, if insurers are going to have to figure out a way to wrap their head around all this innovation that's happening, because right now many insurers say we're not going to cover the weight loss drugs, even for those that need them, and that doesn't make sense.
I love the idea that it's kind of forcing them to change and kind of get with the times. And
Yeah, but the cynic in me is like, oh, so they're going to take the thing that's trying to make things better and they're just going to buy it up. Or, they're going to, I don't know. I'm very cynical about
man,
insurance
good luck
companies.
buying up Amazon. I
Yeah,
don't
it's
know.
true. Well, like
But
if you can't beat them, join them, I don't know. I
yeah, you're right. I think you're right
distrust
to
most
be
insurance
skeptical
companies. Yeah.
of how much the insurance companies can evolve
Right.
to continue to go into like a cost saving for the patient
Right.
side of things. Yeah.
Yeah.
So I guess we'll
Well,
see.
I hope. I mean, my belief is if they truly invest in this pilot with Cost Plus, Blue Shield, and us, is a proof of concept. And that if we can show that we're
Right.
saving patients money and we're keeping them out of the hospital, I start to think that catches fire as a model for others to mimic and to emulate, hopefully. But it's very much to be determined. You're right.
Well, if you can crack teleophthalmology for kind of the average, like
Ooh,
I'm,
what about
I'd be
the
interested.
glasses?
Yeah.
Let's see. Right. You got what you talk about the Ray-Bans that have
Well,
the
nothing that exists, but there's all sorts of smart glasses, right? Maybe
yeah,
someday
Yeah.
there's
yeah.
teleophthalmology glasses that can take the
Well, there is
pictures.
some teleophthalmology that's done like worldwide, but there's limits to it. And I
Yeah.
got
I remember during the pandemic, it's like people
oh
just
God,
trying to put their
it
eyeball
was
by the webcam,
man,
it just wasn't very
it was
effective.
rough. It was rough. I trying to do on the fly, figuring out teleophthalmology in a world in the US at least where it's just not done at all. Eye care just not done. And
Yeah.
it was tough.
I mean, since you mentioned it, none of them have seemed to really risen to the sort of FDA approval. But I, I feel like I remember getting approached with different apps that promised an eye scan that can tell you whether or not you're COVID positive. And I'm wondering, do you feel like the
Ooh.
eye is underutilized as a
Ooh.
way to diagnose systemic disease? And
Excellent
Well, I
question.
will tell you, there's been work done for quite a while about using things like AI for mainly on the diabetes side. So diabetic retinopathy and using that data to figure out kind of how well controlled someone's diabetes is. So diabetic retinopathy is a thing that's been in the AI space for a while because you can. It's one of the great things about being in ophthalmology is you can take pictures of people's retina
right.
and there's really interesting things going on with like Alzheimer's and certain other diseases. Again, it's not like there yet to really make a big impact, but the work's being done. So yeah, I'm really hopeful that selfishly, I would love every hospital, every emergency department to have a fundus camera to be able to take a picture of the retina and to send to people, and I would love that. So I don't know.
Wow.
That's keep working, smart people who do
Yeah.
computers
Exactly.
like you. Go tell Amazon,
Yeah.
get
Yeah.
it going. Get your Amazon Eye.
Yeah.
I don't know.
Exactly.
I don't know what you
Ooh.
Exactly.
call it. I don't know, whatever. But I do have before we finish,
Yeah.
I've got just a couple quick questions for you. When was the last time you saw an ophthalmologist in the ICU?
Oh. Oh my gosh.
Do you ever need an ophthalmologist in the ICU? Is that even a thing?
I'm trying to think if like an orbital eye or some sort of I can't I don't remember.
Such a
I'll
tough
be honest.
question, right?
Yeah, I don't think I've ever
Some
seen.
med student will be listening and think of the one very obscure time
At the
when,
peak of the pandemic, did you ever
yeah.
get any redeployed ophthalmologists up there?
No,
Do you
no, I
remember that?
didn't. No,
No?
I don't.
Okay.
No, was that your experience though, or I'm
No,
curious
no.
if.
I fortunately I thought it might happen, but it never did for me. But my other question for you is last question is: do you check all the patients in the ICU for contact lenses,
Mm.
No, I don't. Should I be?
especially the young people? You got a young person comes in,
Yeah.
you got to check and make sure, see if they wear contacts, like ask, their family. And I always tell like residents and, trainees that because, too many times, mostly I don't head to the ICU very much these days in private practice, but when in training, it's like every week you'd go up there and
Yeah.
someone's admitted. So a young person was admitted for several days, and I take a look at their eyes, and sure enough, they got contact lenses in
Oh,
there, and
God.
that's not something you want to leave in there. So
He talked about that so much that then he was a patient in the ICU and was
Mhm.
not able to speak for himself. And so I was like, oh man, I'm gonna have to ask this intensivist if they've checked to see, if his eyes are like lubricated, what are they doing with his eyeballs? Like he doesn't wear contacts, I didn't have to worry about that. But I had to make
Yeah.
you
sure they
asked
were
about
taking good
artificial
care.
tears
Yes.
Yeah.
for me.
Yes. That's such a, oh my gosh, and so one, it's a great prompt, and thank you for doing that. But two, what's interesting too is we focus so much on delirium. I mean, the morning rounds is, hey, how do we do a spontaneous awakening trial, spontaneous breathing trial?
Yeah.
Think about delirium, get them off the vent, but and talk about their mental status all the time. But gosh, if you can't see properly, because maybe
Yeah.
you don't have contacts in, but you should have contacts in.
Right.
Right.
I've never once in my 15 years thought about, unless prompted by the family, can this person see 20/20? Or can they see clearly at all because of a contact
Yeah.
lens issue, and how that might impact their delirium. So
There you go.
that's huge. That's huge. That's great.
There's an
Awesome.
application
Those
for
are great prompts.
ophthalmology in the ICU.
Awesome. There you go.
It's a really roundabout way to get there.
We got
but-
there. The
got
whole
there.
time, this was just a ruse to end up talking about
Ophthalmology
ophthalmology in the ICU. There you go.
You
I
could do
love
that,
that.
and you could talk about ophthalmology on a plane, right? with Ben here.
That exactly. That's
Absolutely.
actually, there's Orbis. Orbis is like they're called the Flying Eye Hospital. I don't know if you ever heard of this thing.
No.
It's a nonprofit organization. They have an OR where they can do cataract surgery and other surgeries like flying through the air.
And
So, I
why
don't know.
would you need to do that?
Because
it's cool.
Well, I mean, they also will like just park the plane and bring patients in and do.
Again, why?
Because it's a humanitarian effort and it's super
Oh, okay,
cool.
okay.
I see.
Gotcha.
It's awesome as well. All right. Well, Ben, we won't keep you any longer.
No.
We really got off track there at the
We
end.
did. Sorry.
So anything you want to plug, tell us about that you haven't talked about already, that we haven't discussed?
No, I mean, I guess the last thing I would say, and just a kudos to the two of you, is I spent a lot of my time outside of clinical and health and health technology, just on effective health communication. Almost like, I mean, it became overwhelming, but do it for mainstream media. And I have come to really rely on the two of you, both to inject great information out there at scale because you have a large platform. Also keep it light when it's appropriate, and just to be a source of just inspiration and levity when we needed it the most. But just on the public facing communication piece and being somebody that we could look to for best practices, but also just to get the right information out there. Just given that I spend a lot of my time on that as well. I just wanted to say that I don't know if I haven't had the chance to say that to the two of you yet, and so I didn't want this time to go by without just one saying thank you for the fellowship there. But then I think it might be the most important thing any of us do beyond the bedside, which is how do we reach people with better information.
Well, thank you, and the feeling is mutual for sure. And I know you do spend some time still doing the NBC, MSNBC analyst role.
Yeah,
Is that right?
I you don't move to Seattle, Washington, to thinking that that's going to be in your cards.
Yeah.
I think you stay in the Northeast, but I've always done it for organic reasons. It happened organically. I feel like there's impact, just like I think you two have such impact. And so if people trust what you say and you can reach people with good information, it's invaluable. And so no, I try to do it for the right reasons. But
If they ever need an internet comedian ophthalmologist to weigh in on some public health issue, you just let us know.
Let NBC know.
I will do that.
I'm there.
I will do that.
Thanks again, and people can find you on social media. at Vin Gupta, MD, and on NBC from time to time as well. And then what was how can people find more information about Amazon
Pharmacy.
Pharmacy?
Yeah. Well, pharmacy.amazon.com, or please reach out. I'm at Vin Gupta MD. Messages open. Would love to, frankly, love to just get feedback, because I think often the best feedback we get is from providers saying something didn't, maybe could be optimized, or they love our call in line because it takes a minute to reach a human versus 30 minutes in some cases. So just hearing from providers about what's working, what's not working is fantastic. But try something new. Pharmacy.amazon.com. I do think you're going to be delighted and pleasantly surprised for what it means for your patients more than anything.
Great. Well, thanks again for joining us. It's a pleasure.
Thank you.
Hey, Kristen.
Yeah.
Our anniversary's coming up.
Yes, that's right.
You know what I got you?
What?
A bouquet.
Oh, you shouldn't have.
They're Demodex mites.
That's why you
And
shouldn't
look
have.
how cute those faces are, and the little legs.
That is kind of cute, I
You
have
know
to
what
admit.
these things do?
What?
They cause you to have like itchy, red, irritated eyelids.
That's not cute.
Well, it's a disease. It's actually a pretty common disease called Demodex blepharitis.
How do you know if you have it? What does it look like?
Well, you end up with this crusty, flaky buildup on your eyelashes, and it's pretty easy to see if you just look at them
That's
under a microscope.
pretty gross, though.
Yeah. So, well, you don't get grossed out.
Okay.
You got to get checked out.
Okay, that's a fair point.
You
Yeah.
got to go in.
All
You got
right.
and we'll look at your eyelids. You just go to eyelidcheck.com to get more information. All right.
Okay.
That's EYELID check.com to get more information about Demodex blepharitis. These cute little guys.
Yeah, it's the
There
most
you go.
romantic anniversary gift
That's-
you've ever given me.
You're welcome. Well, that was fascinating.
It really was.
Amazon, I feel like I have a better understanding of kind of what
Yeah, it
what
didn't
the
make
hell
sense
Amazon's
to me
doing.
when I first heard about it. I was like, what do you mean Amazon Pharmacy?
Well, I am naturally very skeptical of this
Yeah,
mail order just because of what like Optum has put people through, but I feel like they're coming at it, at least just from the right perspective, right, and really trying to like save people money, and it sounds like it's a great way to try to do that. At least make the health insurance companies a little nervous. Like, oh, we got to change with the times. We got to
people are going to have options.
yeah.
So
It's
I do like that aspect
competition
of it. Yeah.
in a space like healthcare where there's like less and less competition as things
Right.
get consolidated.
But see,
I
then
think
that's
it's-
what I'm worried. Like, then if they're being very collaborative with them, then is it going to be just one consolidated conglomerate of,
Yeah.
I feel like we need to,
things can always go sideways.
right.
But
So I don't know. I don't know what
hopefully-
the answer to that is, but
I do also like the cost plus drugs. You mentioned
Yeah,
that, and
right.
and it seems like a very similar model, and so I don't know. We'll see. We'll
Yeah.
see how it goes. But it was just fascinating to talk with Dr. Gupta about
yeah,
that.
he's
and
had just such an interesting
I like his perspective
path.
on things.
Yeah.
For sure. All right, let's get to we have a fan story.
All right.
Yeah, you want to hear it?
Yes.
Okay, here we go. This is from Stuart. Stuart says, "Hello, Dr. G and Lady G. I'm dying to know, Dr. G, do you have a Jonathan? If you do, you should consider interviewing them for your Knock Knock High series. If you don't have one, you could interview one anyway. I'm sure there are many of your subscribers would love to hear the perspective of a real Jonathan." That's a great idea. Should I get my original
Well, that's
Jonathan
why I was
out there?
laughing, because I was trying to imagine him coming on a podcast. Do you
Luis?
think? Yes. Do you think he would? He's so quiet.
So Luis was my first scribe that I worked with when I started my job out of training, and I kind of built the character around him and the amazing things that he did as a scribe. Now he works as a technician,
Yeah.
which is great because he's got more experience in doing different jobs in the eye
Right.
clinic. So I'm gonna ask him. I'm gonna see.
Yeah,
I'm
let's
gonna
do
see
it.
what we can do. See what we can do about that. And then Stuart also said, "Until very recently, I thought Jonathans were a fictional invention by you, but I posted a question on one of your videos, and another subscriber told me that they were actually real. Yes, medical scribes are real people, and they do real amazing work. I love them. So thank you, Stuart, for that. And thank you all for listening. Thank you for your stories. You can send us your stories, knockknockhi@human-content.com. Let us know what you thought of the episode. What do you think about Amazon Pharmacy? What do you think about Amazon kind of, sending you medications via drone? Sounds cool to me. I don't know. They drop it. We didn't ask what happens if you're not home and they
Well, you have that issue now.
I guess that's never going to go away, but unless you're always home. But anyway. All right. And let us know if you have any other suggestions for guests. We'd love to hear your thoughts. Lots of ways to hit us up. Email us, knockknockhi@human-content.com. Visit us on all the social media platforms. You can hang out with us and the Human Content Podcast family on Instagram and TikTok @Human Content Pods. We just got through the holidays not too long ago.
Mm-hmm.
We spent some time with our family.
We did. Yes, we got together for the holidays.
Our real
Sort of.
family and our Human Content family. Shout out to all the wonderful listeners leaving feedback. We love you guys. We love the feedback, just the ones that are giving us good feedback. No, we love the ones that are giving us not so good feedback either. We love all of you.
Are we getting some of those?
I haven't seen any lately.
Okay.
Which is great. But we welcome all feedback. But if you leave a great review, if you subscribe and comment on your favorite podcasting app and on YouTube, we can give you a shout out. Like Jenny Grace on Apple said, "Best doctor. I love this podcast. Wow, on making eyeballs interesting. Thanks for starting this and hope you never run out of topics." She's referring to the Knock Knock Eye episodes.
Yes, she is.
That I do once a week, where I nerd out on eyeballs with you guys.
I think she is as surprised as I am that you have made eyeballs interesting.
Guess what? I have people say that they love listening to that.
I know people like it
on their commute to work.
Yeah.
Just getting ready for work by listening to an ophthalmologist talk about ophthalmology things.
Got a lot of eyeball questions, I guess.
Full video episodes are up every week on my YouTube channel @DGlockenflecken. We also have a Patreon, lots of cool perks, bonus episodes where we react to medical shows and movies, hang out with other members of this wonderful, brilliant, hardworking community that we have. We're active in it. We're doing all the things. Our early ad-free episode access, interactive Q&A live stream events, and much more. Patreon.com/Glockenflecken or go to Glockenflecken.com. Speaking of Patreon community perks, new member shout out. We got Jocelyn, Michelle H, and Roy R. Thank you all for being patrons.
Welcome.
And also shout out, as always, to the Jonathans. A virtual head nod to you all. Patrick, Lucia C, Sharon S, Omar, Edward K, Stephen G, Jonathan F, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, Leah D, KL, Rachel L, Keith G, JJH, Derek N, Mary H, Susanna F, Mohammed K, Aviga, Parker, Ryan, Medical Meg, Bubbly Salt, and Pink Macho. Thank you all.
There's too many for you to do it all in one breath now.
I know.
It's amazing.
And Patreon Roulette, random shout out to someone on the emergency medicine tier. Shout out to Justin for being a patron. Thank you, Justin. Thank you all for listening. We are your hosts, Will and Kristen Flannery, also known as the Glockenfleckens. Special thanks to our guest, Dr. Vin Gupta. Our executive producers are Dr. Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brooke. Editor and engineer is Jason Portizo. Our music is by Omer Ben-Zvi. To learn about our Knock Knock Hi's program disclaimer and ethics policy, submission, verification, and licensing terms and HIPAA release terms, go to glockenflecken.com or reach out to us at knockknocki@human-content.com with any questions, concerns, or what?
Fun medical puns.
Yeah, those two, if you want. Knock Knock Hi is a Human Content production.
Knock, knock. Goodbye.
Hey, Kristen.
Yeah.
Sometimes I come home from work and I just feel really run down.
Yeah, because, despite popular opinion, you actually do see a fair number of patients every day.
I do. My clinics are pretty busy, but I'm not the only physician that feels that way.
Mhm.
So many people feel overwhelmed and burdened so much that work-life balance feels impossible.
Yeah, nobody gets into this job for the paperwork.
Most people, definitely not me.
Mm.
And but let me tell you about the Nuance Dragon Ambient Experience, or DAX for short.
Tell me.
This is AI-powered ambient technology. It sits there in the room with you. It's transforming healthcare with clinical documentation that writes itself.
Ooh, that sounds nice.
It's like having a Jonathan there.
Yeah,
It's fantastic.
perfect.
And I got some stats for you.
Ooh, I love stats.
You're going to love this. 7 minutes is saved per encounter by reducing clinical documentation time by 50%.
7 minutes. That's an entire surgery for
Yeah,
you.
that's what Dax can do for you. And across all specialties, 70% of physicians report a reduction in feelings of burnout and fatigue.
That's pretty
It
incredible.
really is cool technology. To learn more about the Nuance Dragon Ambient Experience or Dax, visit nuance.com/discover Dax. That's nuance.com/discover DAX. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.